Ever had a urinary tract infection? Want to know how to prevent it? In this video, I'll share 11 effective tips to reduce your chances of getting another UTI. I worked in ER for years, and UTIs were a common reason for visits. These tips can help improve your health. They're simple and scientifically proven, so pay close attention and apply all these tips. Let's discuss what causes UTIs, the main culprits, the symptoms, and how to improve your habits. I'll tell you what to do and what to avoid. If you follow this channel, please like this video. You know it'll be useful. If you're new, don't like it yet. Like it after if you found it helpful and learned something. Why do urinary tract infections occur? When there's an imbalance between bacteria already present on our skin and our body's defenses. This happens when we do something that harms our defenses or when we neglect them. This imbalance allows bacteria to cause an infection. What are the main bacteria responsible? E. coli, Klebsiella, and others like Enterobacteria and Proteus can cause UTIs. But the first two I mentioned are usually the main culprits. What are the symptoms of a UTI? Symptoms include painful urination, lower abdominal discomfort, and frequent urination. These are the primary symptoms. Other symptoms like itching or discomfort may also occur. What about fever? In most cases of cystitis or bladder infection, fever isn't present. When this infection reaches the kidneys, called pyelonephritis, that's when we'll see a fever. So, if you have these symptoms without fever, it could still be a urinary tract infection. At this stage, when you tell the doctor, I'm feeling lower abdominal pain, pain while urinating, and frequent urination, often they don't need tests to diagnose and treat you. I want to highlight this because, as you saw earlier in the video, from my years in the ER, many patients were confused. They'd say, but the doctor didn't order any urine or blood tests, because they're often not necessary. Later, I'll explain when urine and blood tests are actually indicated. But what's a recurrent UTI that really concerns us, possibly linked to our habits? When we have 2 infections within 6 months or 3 UTIs in a year, that's when you meet the criteria for recurrent urinary tract infections. UTIs are more common in women than men, but men can get them too. I'll explain a cause of UTIs in men related to urethra length. Women's shorter urethras mean bacteria travel less to cause infection. That's the main reason. So, how can we prevent this? Here are 11 tips, starting with number 1. Chronic stress is a factor that affects immunity. For example, changes in cortisol levels. How can you improve this? Through better sleep. It's crucial for those with recurrent UTIs to improve their sleep. I could give many sleep tips, but I'll focus on the main ones. If you want a video just on sleep, comment below and I'll make one. But what should you do? Let's explain item number 1 to boost immunity. Avoid caffeine, black tea, mate, and green tea after 3 p.m. At night, avoid white light. This can influence our circadian rhythm. When you wake up, expose yourself to sunlight so your body knows it's daytime. Also, maintain a consistent sleep and wake schedule. This is crucial for regulating the body's natural cortisol production. Following these quick tips, 80% or more of people will improve their sleep. I know it's not always easy, but these are simple tips. For instance, avoid coffee after 3 p.m. And managing light exposure is easy to correct, okay? White light often means house lights, not just phone screens. Got it? This can greatly impact your cortisol and melatonin production. Tip number 2, don't hold your urine. Urinate whenever you need to, of course, if possible. Studies show that workers who can't urinate whenever you feel the urge, especially as healthcare workers or in jobs where you can't easily take bathroom breaks, you're at higher risk of urinary tract infections. So this is really important. Don't hold your pee. Why? It gives bacteria more time to cause an infection. Got it? This is a crucial tip that's easy to follow. Number 3, urinate correctly. You might wonder, what's the right way to prevent UTIs? You're probably thinking, why hasn't anyone told me this before? When I talk to patients, most say the same thing. Oh, I never knew that. Well, you should sit down and relax. Spread your legs wide to help empty your bladder completely. This could be why you're getting recurring UTIs, okay? Many people sit with their legs closed, rushing and not emptying their bladder fully. Empty all urine and have a higher risk of urinary tract infection. You might ask, I work and have to use public or shared bathrooms that are dirty. Can I urinate standing up? Urinating standing up isn't recommended, okay? Your muscles stay tense and you might not empty your bladder fully. This can also increase your risk of urinary tract infections. What's the solution here? You can buy disposable toilet seat covers that make life easier. They're cheap and really helpful. Number 4, be careful when cleaning yourself. We can transfer bacteria from one area to another. It's crucial to always wipe from front to back. Don't reuse the same piece of toilet paper. Many people only mention wiping front to back, which you probably already knew, but many don't pay attention to the toilet paper issue. Otherwise, you'll spread bacteria, even with front to back wiping. Got it? Always clean with one piece at a time to avoid contamination. This greatly reduces the risk of another UTI. Number 5, hydration. Drink water. It's crucial to stay hydrated to help cleanse your urinary tract. A study compared those drinking over 1.5 L daily to those drinking less. People drinking under 1.5 L of fluids daily had a much higher UTI risk. So remember this. We use a calculation to determine proper hydration levels. It's usually 30 milliliters per kilogram of body weight. This is spread throughout the day. For example, at 100 kilograms, you'd need 3 liters of water daily. That amount spread over the day would be good. For some with kidney issues or on dialysis, doctors may restrict water intake, okay? But generally, it's the calculation I explained. Note: recurring UTIs can lead to kidney damage. It's crucial to apply these tips to reduce infections. Number 6, UTIs in men. A major factor for both genders is diabetes. Always check your blood sugar levels. Our body tries to lower blood sugar by eliminating it through urine. This can significantly increase the risk of UTIs. You've probably heard that ants in the bathroom can be a sign of diabetes as urine becomes sweet. This sweetness can lead to urinary tract infections. Recurring UTIs should prompt a check of blood sugar levels. Some medications can increase sugar excretion in urine. These drugs may also raise the risk of UTIs. If you have recurring UTIs, discuss this with your doctor. This applies to drugs like empagliflozin and dapagliflozin. These are medications for treating type 2 diabetes. Number 7, urinate after sexual intercourse. Why? It helps clean the urinary tract. This can help prevent urinary tract infections. Number 8 is interesting. Cranberry juice. Have you heard about this? We're not sure exactly how cranberry juice reduces UTIs. It's especially helpful for those with recurring UTIs. Studies have shown people who drank 50 milliliters of cranberry juice had a lower chance of recurring infections, likely because it acts as a bacteriostatic agent, essentially slowing down bacterial growth. To put it simply, though the exact mechanism isn't fully understood. Tip 9, opt for cotton underwear. This can also be beneficial. Tip 10, change frequently. For instance, if you use panty liners or if you're in a hot climate. Why? Bacteria thrive in warm, moist environments. You might need to change once daily, be it underwear or liners, to help prevent issues. Tip 11, be cautious with chemicals and talc and even direct genital washing. Why? Because prolonged washing, especially, can disrupt bacterial balance. Remember, we naturally have bacteria on our skin, so you don't necessarily catch it from somewhere. An imbalance of these bacteria can cause a urinary tract infection. What now? If you're getting frequent urinary tract infections, you're taking lots of antibiotics, and the infection doesn't seem to improve. Remember when I mentioned exam indications? This is one of them. What's the best test in these cases? The key test is a urine test or partial urine test, depending on where you are. It's a urine culture with antibiogram research. What's that? This test checks if you have an infection and identifies the bacteria causing it. Often, it's not the ones I mentioned earlier, or it's those bacteria but resistant to antibiotics. So you end up with this persistent infection. You might have 2 or 3 infections in a month. It's not new infections, but the same one that won't clear up. So ask your doctor if this test could help you. There are other, more complex tests, but usually clinical evaluation and simple tests, when properly ordered, are enough. Did you enjoy this video? On a scale of 0 to 10, how would you rate it? If it's a 10, I'll make more videos like this. Don't forget to mention your city and where you're from. I'd love to know how far this video has reached. Share your city and I'll send you a virtual hug. I'm speaking to you from Porto Alegre. Now I've got a video suggestion for you about vitamin D. Could vitamin D actually increase your risk of urinary tract infections? Or can it help fight off infections? What are the pros and cons of vitamin D? In this video, I break down everything about vitamin D. You'll love it. Take care and see you next time.